All right. Well, good afternoon, everyone, and thank you all for joining us on this really great, exciting webinar about how states are using data. I have Laura Sainty, who will be presenting for us this afternoon from the Texas Department of Housing and Community Affairs. Just a couple of quick housekeeping items. Everybody is placed on mute, so if you have a question, please put it into the Q&A or chat boxes. And we will also unmute everybody at the end to be able to ask questions and have some dialogue. So without ado, I'll turn it over to Laura Sainty. Laura?
Hi, if you could just verify for me that my screen is now being on.
You see your screen and we can hear you.
Okay, great. So everyone, this is Laura Sainty. I'm the Project Manager of Training at the Texas Department of Housing and Community Affairs for the Community Affairs Division. And I'm going to just be presenting different things on how we use data to help develop our state plans, our training, and also work with community action agencies to improve their performance. Something that we'll look at is I'm going to share how we use data to make informed decisions to improve the efficiency and effectiveness of CSBG operations in the state and the outcomes achieved for low-income households. So how to hit that data to tell the story. Several driving forces for using data to make decisions, the impact that we have on people's lives in the communities that we serve, the constraints that often present themselves to us, poverty levels, changing demographics, income inequality. Community needs assessment identifies and prioritizes the needs. The community action plan lays out the impact, the outcomes, and targets that an agency wants to achieve in its communities. And look at the reports, surveys, case notes that track progress. And this is then analyzed to improve performance, to make decisions, and impact lives. And if you are Roma trainers, that should sound pretty familiar to parts of the Roma cycle.
Hi, I think your screen is being shared, actually.
Okay.
A couple folks have been responding that they're not seeing the slides moving.
Okay, share my screen. All right, here we go again.
Here we go.
Sorry about that. Here we go. Is now?
Perfectly.
Okay. The things that we're looking at are performance management framework. Not only does it tell us how well we're doing, but it also shows us what difference that we make. Look at the components of this, and the organizational standards reflect the agency's capacity to make an impact. State and federal accountability measures provide the state sort of boundaries to serve CAAs better and sort of what things we're going to look at to measure that. Roma is a system for achievement, and together these are all indicators of the difference we make on people's lives. And that shows up in our national performance indicators with our family level and our community level indicators. Using data. In this slide, we're looking at how the state uses its accountability measures. So we capture performance data. We look at how efficiently and effectively the state plan was implemented, what impact the state efforts have on local performances, monitoring and training for success. All of these things come into play when we look at our accountability measures. So we have monitoring, organizational standards, data, and reporting are all ways the state uses and tracks data for accountability. Our community action plans, our monitor reports, our level of risk that we assess agencies at, and how many of our agencies have met the organizational standards to reflect if we have the capacity to impact lives in our communities. Are the CAs satisfied with what the state provides and how we provide it? And the annual report reflects that the funds are being used for the purposes it is intended for, and that is to help people that are in low-income communities and thrive. Here we get data from the Community Action Network back to the state. We get feedback from them through the ACSI survey, through their individual conversations with their trainers, through Survey Monkeys, through monthly reports, the Community Needs Assessment, the Action Plan, and the Strategic Plan. Plans provide the state data on the needs across Texas. It gives ideas of what are the resources that we have in the state, what programs are available, how do agencies plan to address the needs in their community, and then we get input from them to help us improve and identify needed training and technical assistance topics to boot. I'll show you how we use some data tools in Texas to help our agencies and to help us assess our network. The biggest tool that we obtained about 5 years ago at the end of ARA was a tool called WUFU. It's a software system that allows us to put sorts of forms, upload boxes, questions and answers. We use the Q&A portal on this every single day, multiple times a day. And also agencies or network can ask for requests for specific training needs that they might have. All of this data can then be exported into an Excel sheet and can sort data out by program, topic, or an individual subrecipient name. And then that data then determines what sort of trainings we're going to do. Sometimes that data will show us that the entire network needs a training on some topic. Other times it may show that an individual subrecipient needs some sort of help. It can also, we also filter it out by repetitive questions, then get put onto FAQs that we post on the different program pages. We create best practices for some that are require a little more detail. We'll offer webinars or guides depending on what sort of things surface in that question portal. And they'll create tracking forms for different requirements. So this is a screenshot of some of the forms that we've created in this WUFU, where we have community affairs training surveys in here. We have questions that are internal to our department. We have documents that they can upload. Director's roster submission forms for assistance. We have weatherization production submissions, those RFAs, all kinds of things. I'm going to show you what this looks like live if I can get into it from here. Is the WUFU, and these are the questions that people ask, answers that we can put in here. So you'll see we have different ones from Jen and I have answered. I can see how many answers each trainer has provided. When I click on the individual question, I find what date the person asked it, what question was about, and what answer did we provide. An extremely helpful tool. There's tons of forms that we've created. Here, we have extra assistance where they could upload reports for that. Actions. Follow me on this. I'm sorting all through it at once here. Let's see. And then customize the forms and make them look just the way you want them. They can say whatever you want in them. So this would be our document submission form. They put their name, certain things that have an asterisk they have to put in, and actually browse and upload documents into it. It holds quite a bit of data. It's been very, very helpful for us. I'll have to get back to you guys.
We're Laura.
You're all there? I can't get back to the webinar. Okay, I'll just go to my slide. Sorry about that, guys. Okay. Being special on this end. All right, thank you for that.
We've got them up now. Yeah.
All right, here we go. So Texas, our monitoring department and our training department are separate. I did that for the separation of duties. So our trainers have to meet with our monitoring staff to make sure that we're all on the same page. We'll do a pre-conference meeting to talk about what agencies are coming up. Once the monitoring begins, they'll do a desk review. We'll often meet with them after they finish the desk review to discuss issues that they noticed and to help guide them as to what we've done with the agencies and what sort of information we've given them and that we've given the different subrecipients. Go out and do an on-site visit, and they'll produce a report from that. Once that report is produced, and we meet with them again and debrief and do a training and technical assistance plan to address any findings or concerns that need to have specific guidance or training. Sometimes that could be as simple as an email with links to resources for them. Other times it could be an on-site visit where we do intensive, typically around the finding or the comments or the individual deficiencies. We all have organizational standards that we analyze to look at to see how many people have met the standards, how many have not met them. We provide this information with an update to OCS, first through our state plan, which sets our goals, and then through our annual report that reflects did we achieve those. We determine training topics for conferences and workshops through those that one met. If they weren't met, we look at those and make a decision as how we're going to handle it. So a few years ago when we did the organizational standards assessment the first time, we found that community needs assessments were lacking. And so we've done about 4 different trainings on community needs assessments over the last 3 years. And we'll probably continue to do a little more tweaking on that with trainings. We identified that there's some other areas like the organizational standard 4.3, the full implementation of ROMA, which I'm sure a lot of you are struggling with that one as well, and working on guides and helps that will be able to for us to be able to show that they have met that. We identify agencies that may need intensive assessments, and we have a contract with a separate entity that will come out and do intensive assessments with different agencies that we identify, and they will work on specific areas. A lot of them are the organizational standards. So the tool that we created to agencies with the organizational standards, I'm going to take you live on this and show you how that one works. So you click on the standards and look at, say, it's something along board governance, that each of them are, and you click on it and it will tell you what documentation we're looking for in order for that to be compliant. They go through each one and it'll tell you or minutes and rosters and bylaws. Them helps our subrecipients know what to upload. I can go back home at any point. Also other areas like calendar required actions for governing boards that will help for them. They have to maintain what ones are annual. Risk management, there's standards related to the CNAs. This little interactive PowerPoint has been extremely helpful, not only for the subrecipients to have a self-guide, but for us when they call in and they need assistance with that as well. We'll often go in and use this interactive PowerPoint. We have it for public entities and private entities. There's also a guide for each of these PowerPoints in Word. It's been helpful in us improving our organizational standards that have been met. For example, in 2016, we had 2 agencies who had met the organizational standards at 100% out of our 40. And in 2017, we had 10, 12 actually. And it was a big improvement for us. We're currently having subrecipients upload their 2018 documentation and hoping that more achieve 100% and the overall improvement in each category goes up. Training and technical assistance is driven through the ROMA cycle. If we're going to have our subrecipients use ROMA to evaluate themselves, we feel here at the state that we should use it as well. So in training, we'll look at compliance reports, assessments, and requests, and CSI report, determine what sort of trainings we think we need. We then with our state association and we talk to them about the surveys they've conducted as well. Plan, as a matter of fact, the state association met just last week to work on our joint TTA plan, and we went through this entire process. We looked at all of the data from what needed to happen and what things we all need to be trained on. We compared the states to the state association's data, then we made a joint plan. We looked at budgets, and then we looked at what sort of delivery methods we think we need to use. We're in the process of prioritizing for implementation and enabling trainers to do different sorts of trainings. We have certain trainers that are very good at organizational standards, others that are really good at case management, frontline staff, and so we try to schedule who's best at doing what, do the different trainings. We'll look at the achievement, what happened from trainings. Did performance and expenditures increase? Did more clients get served? Do we have better stories that were told from our agencies about what they were able to do to impact lives in their communities? And we'll look at also lessons that we learned during that time, and then we'll evaluate it through, again, CSI, through surveys, and through a SWOT analysis. Looking at all of these things, we often come up with best practices. That during we had one trainer who would sit at his phone, and all day long he would answer the same 3 questions over and over again. Never got to do hardly anything else during the day because he got questions from our agencies that were just repetitive. So I started tally stroking them. We said any that he got multiple times, we would make either a frequently asked question out of it, a best practice, or some sort of guide. And we started posting those on our web pages. And those phone calls, because we taught them where to go to get what they need on the web pages, and they can go get that information for themselves these days. That frees up the trainers more time to focus on and evaluation of plans and assessing data. The American Customer Satisfaction Index survey was huge for us a few years ago. The first time we got it, I have to say, it was really brutal. We scored very badly, and we had a lot of comments. And as we evaluated our scores and really looked at it, we found that our communication was probably the most impactful score in the area that we needed to improve the most. So we started things like biweekly e-newsletters, and we started sending out notifications through mass emails or through a listserv. But people started saying, I'm getting inundated with too many emails every day. So our state association and the state got together and decided that the state association would put all of the announcements in a biweekly newsletter and send it out so they only had two a month that they get. That's comprehensive. That's very helpful. We've also done roundtables and work groups. We have quarterly network calls for the entire work, and then we also started quarterly weatherization calls to address specific technical areas that needed to be hit upon. State office staff does question and answers at the State Association board meetings. Summaries of changes to plans and rules that we send out, so you don't have to read the whole thing. It kind of just bullets the changes that were made. So people have to read a couple 100-page document. They can just go through a 1 or 2 pager. We've moved our monitoring tools and consistency in that area. And we've also done changes to our training delivery methods. We've started doing a lot of regional trainings where we invite agencies from the same geographic areas together that we can talk about the needs in their area, and they can have more connection with their neighbors who might be able to help them resolve some of their issues as well, or think through some of the ways that they can handle needs or partnerships that might be available in their area. Our ACSI survey from 15 and 17. If you notice, in 2015, our score was pretty bad. And in 2017, we actually increased by 23 points, which is a huge increase, even though we're in the median range at a 68 when the national average is, I believe, 71. So we still have a long way to go, but we have made improvement and show that communication was one of the biggest areas we had to work on. And we also know that making sure our monitoring and our training is lined up is extremely important as well, which was the impetus for us doing those trainer-monitor meetings during and after monitoring visits. The state and help the CAs. We create tools to help them, needs and causes of needs, staffing and office location, evaluating their production, evaluating the accuracy of it, looking at training and technical assistance needs, and looking at their targets that they set versus what they actually obtain. So I'm going to take you through a couple ways that we do this. We used to use Community Commons, which is now over on the CAP website. It's called the Community Assessment Tool. We use this quantitative data to identify conditions of poverty. We use the zip codes maps to prompt areas that we need to drill down that qualitative data more. We use poverty population analysis to production, staffing, service center locations. And just recently, we created a new guide on how to use the community assessment tool, which is here. Open that up. So how to guide, how to do assessment. So it's a screenshot of every single thing, showing them how to run a community needs assessment on it, and then also how to pull poverty population data by county and also by zip code. So if you copy of that, that is on one of our web pages, and I can link you to that as well. example of one that I sent out to an executive director as looking at the poverty population numbers in her county. It's an agency that serves one county, El Paso County. Put these little east, south, and west locations and did a little summary of what I thought. She back and put all of these other lines on this and sent me an email saying that I missed it because it was way more complicated than what I could see. She explained to me that there were geographic barriers like this 7,192-foot mountain in the middle of the city, and then Fort Bliss over here. And Fort Bliss only has one highway that runs through it, and it's pretty much its own city with access to the public. And surrounding the Fort Bliss are all the colonias, very high poverty numbers that's not even captured on our census data, and that's limited access, which made it very difficult to get to them as well. They have a highway, that interstate that runs through it that divides the city, that makes it difficult for people who live on one side of the highway to get to an office on the other side. She sent me this huge description of everything going on, which was fantastic because we had this beautiful conversation that to acknowledgement that she had her service centers in the right locations and a really good job planning where to put those. But a way for her to evaluate some changes that she thought she might make after looking at these numbers as well. So it's a great tool for prompting conversations on going deeper. Also use it to talk to new executive directors and new managers about the different domains in SG, and when you get the quantitative data, what assumptions can you make from that, and how various data points interconnect. What's the level of need? Is it a community level or a family level? So one time I did this with an executive director, and I sent an email that looked like this that you can hopefully see on your screen. I said to her, was looking at the data, 7% of your service area is less than 55 years of age. That's able to work ages. You have counties with the highest households in poverty and 470 unemployed persons that need to work. 60 possess a high school diploma or less. Knox County should be where you have case management services available because they're the highest ones. Case management could focus on certifications, educations, to help them get good paying jobs. What employers are available in these areas. I was able to look through all the data and pull that sort of connection from it, just from looking at the different graphs, at the different 24% have no high school diploma, and about 2/3 of their population only have a high school diploma. So if they're looking at living wage jobs, certifications would be helpful. On the whole thing, but it's just a way to walk them through connecting the dots, which is super, super helpful. Sorry, I'm clicking on the wrong button. You'll have to forgive me. There. The one. There we go. So during Hurricane Harvey, we had agencies in many counties that were affected. And agencies had staff and offices, staff who lost everything, offices that were demolished. They was totally gone. They had Meals on Wheels kitchens that were totally taken away. They had offices that were underwater. So we had one agency in particular, the Hidalgo County Community Service Agency, put together an emergency response team, and they actually drove from Edinburgh, Texas to Beaumont, Texas, which is like driving from D.C. to Myrtle Beach every week. And they went there 5 weeks in a row, went over to help deliver services and take applications. And when they got there, they called and they said, wow, we don't even know where to begin. And so we used the household poverty data by zip code map to pull up where were the highest households in poverty located. And then we overlaid that map with a flood map. And these are the areas that you should probably set up house. Did and served people and how many hundreds of thousands of dollars that they were able to get out in disaster relief. But it was just a beautiful mesh of using data in order to help drive where to go. We have households in poverty to help with our weatherization agencies on production. Example of the counties that this weatherization agency serves, households are in poverty in each county. Percentage is for what percentage of poverty is that for each county? Their location, keep weatherization and their DOE weatherization based on their average household expenditure from the previous year. How many units would they be able to do in each county? Keep in DOE. Look through this, you can see that Collin and Denton County compose about 51% of their entire households in poverty. And the two counties have the most production needed. 40 houses almost in each of the counties would need to be done in order to fully expend their allocated amount based on poverty population. Then counties that are very small that only need basically one house a year done in order to serve based upon poverty population. So they use this information to help schedule their assessors, to help schedule their contractors, their fund inspectors, and to help decide how they're going to expend their funds. So, for example, Collin and Denton counties, they may have to have a contractor there all year long, but in a county such as Rains or Morris, they only maybe need to see those counties on a rating cycle. Maybe every 3 years they go and do 6 houses there instead of going every year. Because Texas, you have to understand, we serve 254 counties. It's hours and hours and hours to get to serve counties. So to be able to keep a contractor or assessors or crews in the geographic area is really helpful to efficiency and to production. We also use this with our utility assistance program, which we call CAP. You'll see at the top there. This is an example of how many households are in poverty for this agency. The percentage based on their allocation, and their average household expenditure, how many households would they need to serve in each county to fully expend that poverty population allocation. And then we compare that to how many they do serve in each county and where are they underserving and overserving. And that will help them move to the areas where they can take more applications in order to expend and serve more households. Community Action Plan, we also use households in poverty to determine, do they have their service centers and out centers located in the right counties? If I was to look at this and 22%, this code one, 22% is in this zip code and they have no service center there, I would want to ask why. But then, so I'd be happy with that. This is using house and poverty by zip code for an agency that only serves one county to determine how are they going to effectively reach the people in the different areas. I remember when we first came up with this tool, working with an agency that served 12 counties. Their office was in the county that had 46 households in poverty. Counties that had 2,500 to 3,000, no service center or outreach site. And we said, if you need to increase your performance and expenditures, you need to be where the people with the most need are. And they changed that, and they put service centers and do outreach in those locations. And they're back on track and on target for full expenditures and for increasing the services that they've rendered. It's really fun to see. Another way we've used data is to look at, I don't know about you all, but here we've had some agencies when the community organizational standards came into effect and people realized they didn't have the capacity to do it. They relinquished their entity status or service area, and another agency or another organization picked it up. Some the neighboring organization would pick it up and they would absorb some counties. And looking at, if you're going to absorb these counties, are you looking at what you need to put in place in order to do this well? So situation in 2013, this agency served 11 counties with a total budget of $3.5 million. In 2017, this agency is now serving 20 counties with a budget of $5.8 million. It almost doubled its counties, and it was about 67% more in funding. So the question we prompt to that is, did you increase your service center locations? Have increased your staffing? Have public information, public are in those new counties to let people know who you are and where you are? It's very interesting to hear what was going on. Some did a really good job with that, and some had hardly increased their staff or service center locations at all at the very beginning, and they were struggling getting those areas served. So when we did this sort of analysis with those in poverty for the different counties, really helped them figure out where to go and where to set up. So thinking about your state and your agency, what are your outcomes that you hope to achieve? How do you measure success? What are your data resources? And how do you use your tools? With that, I'm going to open it up to question and answer. Katie?
I'm seeing a question about whether or not there's a charge for WooFoo software.
It's not very expensive. I don't remember the last time that I know originally it was like $600 for the year and covered 15 maybe users. Using it for like 5 years, so I'm not quite sure how much we're paying now. We upped our users. It might be a little bit more, but it is such a great software for us. We procured it. You'll have to go out for procurement. I don't know who else does that these days. That has just been so user-friendly and so key to us analyzing what needs are.
Great. And then since WebEx is being very difficult today, I think you would have to go to the participant tab on the top and hit unmute all so that people can just ask their questions if they have any.
Okay. Some are no longer on my screen. I don't know what's going on.
Yeah. It's being tricky.
I'm going to back in.
No, I don't think it would work if you go. And I think that's fine. If anybody has questions, please be sure to type them in the chat bar and make sure that you're sending it to all panelists, please.
Oh, we are. Stop sharing my screen. Here we are. We'll mute everyone.
Good tab that says participant at the top.
Okay. Oh, there you go.
There we go. Everybody should be unmuted, so if you have a question, please feel free to ask.
You know, we also use that WUFU to upload their community action plans, and that's been helpful too because we can pull those and then just start reviewing them from that.
So we're getting some background noise. If you could just make sure to mute yourself if you don't have any questions. We had received a question. Somebody said they really love the interactive PowerPoint that Texas has on their state guidance on the EOS. Are you willing to share?
Yeah, let me show you where that's at. Am I still sharing my screen? No. Let me share my screen again.
Can you share?
And you my screen now.
Yes.
I'll tell you how Valley is. Yes.
So do a Google or a web search and you put in TDHCA. We'll see the Texas Department of Housing Community Affairs. You click that. And then you go to Programs, Community Affairs, CG. Under CG eligible entities only, this link here. You'll find this is our new community action plan, which is an Excel form that forces people to use the services, FNPIs and strategies and CNPIs. We have our community needs assessment planning guide, our strategic planning guide. These are the organizational standards PowerPoint. This is kind of a webinar that shows the upload system that we use. This for public organizations, the PPSX is the interactive PowerPoint. And once you open that up and put it into full view, you can then interact with it for public and private. Yeah. Which is helpful. We have a best practice page right here where we get some guidance of things that come up from our subrecipients, the sample cost allocation plan, client checklist. On our program guidance page, of course, the rules and regs. And we have created an income calculator. This is upon the way we calculate income for this. We have links to NASCAPs for the different modules. Then we have our frequently asked questions or guidelines. If you go to our CAP, the one that says CAP, Utility Assistance, Program Guidance page, under our new service delivery plan is that community assessment tool instructions that I showed you. We use the community assessment tool, a PDF that you could use to give out to people if you'd like as well. Okay. Any other questions? says Karen's speaking. I don't hear you, Karen.
No? Okay, well, if we don't have any more questions, I'd just like to thank Laura for sharing Texas' approach to using data. I'm sure that a lot of states are finding this information useful and will take back a lot of good ideas. Thank you to everybody for joining today's webinar. I know we had some glitches here and there. Thank you for bearing with that, and we'll be sure to share the slides and recording for this webinar, as well as the first webinar we had on the 31st with Chris Shano from Michigan, and we'll be sharing that in a constant contact that will go out by the end of this week. So thank you so much again, and I hope you enjoy the rest of your day.